Good afternoon, everyone, and welcome to A Gathering Place brought to you by the Gullah Geechee Chamber of Commerce. We're excited today because we have three special guests who are joining us to talk about testing, contact tracing, and the coronavirus pandemic. These guests are well learned, and we're excited about having a global pandemic expert with us. So we want to thank Tiffany James for reaching out to us and in getting us in contact with this special guest. First, I want to introduce Dr. Winston McIver. All of us know Dr. McIver. Good afternoon, Dr. McIver.
Hello, Ms. Hemingway. How are you doing today?
Wonderful. Thank you very much. Good to see you today.
Yes, great to see you as well.
And I want to bring on our special guest, Dr. Yaneer Bar-Yam. He is an MIT physicist. Am I saying that correct? You are MIT physicist?
I studied at MIT. I'm a professor at the New England Complex Systems Institute. So I'm a
And you founded that institute?
What? Yes, I founded it.
Yes, you did. Okay, very good. So you are a global pandemic expert, and thank you for joining us. We are so excited about having you with us. So we're going to bring in Dr. Bell when he joins us. He's enjoying his birthday today, and we're going to wish him happy birthday at the end of the show, but he'll be joining us in a few minutes. But we'll get started today with Dr. McIver, as we usually do, giving us statistics of what's going on regarding COVID-19. Dr.
Okay.
McIver.
Thank you, Marilyn. It's good to meet you, Yaneer. It's good to meet you. So worldwide, right now, in the last 8 days, the number of cases of COVID worldwide has gone from around 4 million cases to around 4.8 million cases. In the last 8 days, the number of cases worldwide number of deaths, that have gone worldwide has gone from 307,000 to 316,000 deaths. In the United States, in the last 8 days, we've gone from about 1.3 million cases up to around 1.5 million cases. In the United States, the number of deaths in the last 8 days have gone from 88,000 to around 92,000. South Carolina specifically, we've gone up from about 500 cases in the last 8 days, and the number of deaths have been about 10 deaths in the last 8 days. In Horry County, we've gone from roughly 278 cases up to around 293 cases, and the number of deaths have gone from 16 to 18. In Georgetown County, the number of positive cases have gone from 50 up to 52, and the number of deaths has stayed the same at 3. Now, whenever I give these numbers, I always give them with the caveat that these numbers are most likely underrepresented and underestimated. Again, I'll say that there are a number of people who are dying at home with diagnosis of heart attacks, strokes, who this may be, whether maybe COVID related, but because they're dead, they're not being tested. So we have to understand that the number that are given are not necessarily the true accurate number of people that are either positive or died. Likewise, South Carolina just about 10 days ago just got over testing 1% of the state's population. So again, the numbers are going up as far as the testing that's happening, but we just got over the 1% mark. There's 5.3 million people in South Carolina, and we probably now have just gotten to around 80,000 tests. So we're still lagging behind on that, although it does appear that the number of tests are picking up and the availability, but still far below what it should be.
Dr. McIver, yesterday in the news, I saw the numbers reported that as of yesterday, there were 0 deaths in South Carolina.
Well, again,
did you know that?
Again, if somebody died at home from a heart attack or a stroke, it could have been COVID related, but they may not have been diagnosed as a COVID related death because they weren't tested positive. So these positive tests for COVID are what should get associated with the numbers that we're receiving. But again, if these people aren't getting tested, then we won't really know for sure.
Okay, so has the world starts to reopen, in particular the United States starts to reopen, and we haven't been very good about social distancing and staying at home as a country. Um, what is the expectation from a medical doctor's point of view? And Dr. Yaneer, I'm going to bring you into this also because you wrote an article in CNN this week that I really do want to get to and get into that. But Dr. McIver, for South Carolina, and I know this is your opinion, but what are your expectations regarding those numbers we're looking at now?
My expectation that these numbers probably will go up in the next 2 to 4 weeks. We have the pleasure of living in a coastal area, and I haven't seen the traffic in Myrtle Beach this much in a long time. So there were a lot of people here this weekend, and there are a lot of people that are leaving today. So, you know, I know a number of the bike rallies were postponed until July, but a number of places still had bike rallies, so to speak. So that's concerning. The concerning amount is that, you know, I went in the grocery store earlier in the day yesterday, and I had my mask on, of course. And to my surprise, about 85–90% of people in the grocery store had masks on. But then when I went and took my daughter out for a drive yesterday, and we were driving and saw people walking, most people didn't have masks on. So, you know, in a lot of pictures that I've seen, a lot of people did not have masks on who were in Myrtle Beach. So the concern is that I don't think people are taking this as serious as it should be. I think people are looking at it as, well, you know, only 2% of people are dying, 3% of people are dying, and that's just not a way to look at it. It's almost like people are resigned to that there's going to be a certain number of people die. It's almost like, well, if 130 people die, that's just 130 people that died, and millions live. And that's not the way that we're trained as healthcare providers and as physicians to look at it that way. And right now, if we're talking about, you know, 91,000 people died, that's a medium-sized, small-sized city.
I mean, that's my hometown, Georgetown, dying 10 times over.
That's a whole city that has died.
Yeah.
And so that's the concern. The other concern is, and we'll get into the testing later, I'm sure, but the other concern is that as most pandemics go, there's usually a second peak. A lot of them, particularly the Spanish flu. So what's going to happen in October, November, and December when we're back in cold, flu, and pneumonia season, and then we may be dealing with another peak of this COVID-19. So that's a huge concern, not just now, but getting people's mindset ready for winter is not too far off, fall is not too far off, and cold and flu and pneumonia season is not too far off.
Yeah, and that's why this reopening that's happening now, it really should be well thought of. And Yaneer, you wrote an op-ed piece on CNN's website, and the actual title was "Don't let governors fool you about reopening." And you get into some details of things, but tell us, you have 15 years of experience with pandemics, studying and researching pandemics. Why is it so important that we don't let governors fool us about reopening, and we have some understanding about the impact of this?
So let me start from very basics. So first of all, they're trying to convince us that it's kind of okay. And one of the things that is not obvious is that we stopped the outbreak using the social distancing that we used, so that only about 1% of people, less than 1% of the people in South Carolina have gotten the disease. And if we don't stop it, then it's going to affect probably 100% of the population. And it's not in the fall. It's basically going to be over the next few weeks. The disease spreads very rapidly. So if we don't do social distancing, it's going to multiply by a factor of 10. And if you do a little bit of social distancing, it's a factor of 5. But that means that every week it grows so that it rapidly increases. Why did they stop it before? Well, maybe they didn't care as much about lives as they should have, but it overwhelmed the medical system. Right? There were too many people in hospitals. So they stopped it. So you ended up with only a few tenths of a percent of all the population. But if you don't stop it, it's going to grow, and there's going to be 100 times that many people who are going to die.
Right. So are
you
recommending now?
And 1,000 times that many people are going to be in hospitals. And in fact, when I say 100 times that are going to die, it's even not a real estimate, because if you overwhelm the hospital system, then about 10 times as many people die. 1 in 10% of people who are going to get the disease are going to die. And one of the reasons that people don't see this is that the first few weeks of the disease tend to be mild. So let's say you wait and you see how bad it's going to be. By the time you see how bad it's going to be, there's a lot more people that are sick, and there are a lot more people that are going to be in hospitals, a lot more people that are not going to get the care that they need. So this is really a very, very terrible disease, and there's a concerted effort by the, quote, powers that be, by the people who want everyone to just go to work and pretend that everything is normal, to try to convince us that this is okay, that this is just normal, and it's really not normal. So I worked on Ebola in West Africa, where 50% people died from it. And, this disease is, you could argue, not as bad as that disease, but it's a terrible disease. It's something that we really shouldn't accept. There's no compromise with this disease. And if you don't want to sort of look around your family and friends and say, 1 in 10 of you is going to die. And by the way, the more we learn about the disease, the worse it gets. Even mild cases, there's permanent damage that we don't understand yet. Permanent damage, not just to your lungs, but to many of your organs. And so it's very scary. I really think that everyone should be very deeply scared by this disease.
Yeah. I agree with you 100%. The concern that I have is that as each couple weeks or week goes by, we're learning about another route of passage. I mean, we know respiratory, we know contact, we know that there's some oral fecal involvement with the stool, but now finding viral particles in the semen, and most recently finding that there are receptors in the eyes that can be a mediator for this virus getting into the cell, i.e. getting into the eyes and tears. There's a concern here. And, I study medical history. I studied this stuff. I worked at the CDC. I am concerned about this because there's still, I believe, a lot that we don't know about this. Now you're popping up with 150 kids in about 18 states that are being seen with this multi-system condition with heart and kidney failure. It's concerning. And I don't think people are taking it. Well, I don't think a lot of people, or enough people, are taken as serious as they should. This is a multi-system condition.
We're not leading from with the health experts. We're getting mixed messages from our government, from the federal government, and too many of our state governments are giving us mixed messages. And just South Carolina in particular never really shut down.
Right.
Even the message was not stay at home. It was stay at home or work, because they were more concerned about the economy rather than the impact of the virus itself on our health and our lives. And so, Yaneer, are you saying, I want you to say what you're about to say, but
yeah, so I want to follow on that. There's another really important point, in addition to the fact that it's a terrible disease, and that is that the failure is not just a failure to protect, it's a failure to understand that we can get rid of the disease.
Right.
And if we get rid of the disease, we don't have to compromise with it. The fact that South Carolina and a lot of other US states didn't take effective action doesn't mean that effective action is impossible.
Right.
It is possible. We got rid of Ebola in West Africa, and we have 41 countries in the world, and there are 4 states in the United States that include Vermont, also Alaska and Hawaii, which have some advantages, but also other states have done a much better job than South Carolina, including New York and New Jersey, but also Louisiana. And they suppress the outbreak dramatically. And so the point is that once you can make it go down, you can get rid of it.
Right.
You just have to keep getting it down. Just like it went up really rapidly, it can go down really rapidly and can go to 0. And there's a special property of the number 0. No matter what number you multiply 0 by, you still have 0. So the key is to understand that we can get rid of it, and to understand how to get rid of it and to get us there. And the other thing which complements those is that I've learned, from the work in Africa, but also just by understanding, the way things work, is that the solution to a disease is always in the community. The government can support it and they can create confusion, but either the community does it or it can't be done. And if the community does it, you can do it even with hard work, but you can do it even without the government. And that's the most important thing, because you have to feel like it's your choice. But it's your choice, not individually. It has to be the community.
Right.
So that's why it's really important that everyone's on board and working together to get rid of this disease.
Right. I constantly say this: the disease is the constant, and we're the variable. So if we just do what we need to do,
that's right.
If we need to do what we need to do, the virus is the constant, and we're the variable. If we do what we need to do, we can do exactly what you say, Yaneer, and drop these numbers down.
That's it.
I want to bring Dr. Bell in. Hi, Dr. Bell. Thank you for joining us. Glad you were able to get on.
Thank you very much. I had a little technical.
Good to see you.
Had a little technical difficulty, but I've been listening to the conversation, and the thing that I'm concerned about, since we are talking about community, I'm concerned that the community is not appropriately educated about what's going on here. I think the community is totally confused. I don't think that there are enough people like us that's out there explaining to the community in a way that they can understand what's going on. I had a discussion the other night with a group of men, and we were trying to determine what can we do for our community locally. And one of the things that was brought to my attention is that there's a segment of the African American community that totally has not bought in to what's going on with reference to this virus. I think they refer to them as the Z generation. That's the generation from 18 to 35. And of course, to confirm this, whenever I'm out about, and I have to, I notice that it appears to be that generation that does not do social distancing, and they do not wear the mask. I almost want to grab them and say, what is it about this don't you understand? So I did a little checking around, and I'm finding out that that generation of people do not look at television, they don't listen to the radio, and their primary source of information is through YouTube. And on YouTube, they're only looking at videos. Any program that involves any commercials or giving out any information, they're totally oblivious to that. And so I'm concerned that you know, even if I decided to take some masks down in the hood and give the mask out, I'm concerned that a lot of young people probably will not even use the mask because they don't understand what's going on. And furthermore, they don't trust the medical profession, and least of all, the government anyway.
Well, the
So,
government is not being, shouldn't be trusted now. So they're probably right about that.
right, right.
The question, I think, is not who they don't trust, but who do they yes trust? And trying to understand, you know, that this is, you know, this is a family responsibility. This is a community responsibility. You have to find out, you know, how to transfer. And when you say it's a community responsibility, if you think of yourself as physicians as carrying the responsibility, I think what you need to do is to all the people who are listening to this, it's our responsibility, it's everyone's responsibility to reach out to who you know, your family, your friends, and spread the word. And serious conversations are the right conversations, and asking them what are they doing and how do they feel, and explaining to them how you feel and what you understand is the way to go. We just got to spread the word to make sure that everyone understands what's going on.
Yaneer, when you were working with the Ebola pandemic, what type of community outreach took place then? How did you get the community involved?
In West Africa, I was working originally mostly with government people and UN people and other things, and it wasn't happening. They were projecting that it would get to burnout, 20 million population, so 10 million people would have died if that was the case. And I wasn't happy with what was going on, needless to say, at least it's obvious. So I got in touch with an organization that got me to people who were working in West Africa. And I talked with them and I explained to them what I thought should be done, that in the community they should do testing. And they said, hey, yeah, that's a great idea. We started doing that 3 weeks ago. So they did it. I didn't tell them what to do, and it worked. And we ended up with a lot of people dead. There were 10,000 people dead. But 10,000 people is 1,000th of 10 million people dead. So it was a lot less than what people were projecting, and it's because the communities made the decision. I didn't, and the people that I was talking to, the physicians that were there, they weren't the ones that made the decision. It was the communities themselves that made the decision. So I worked later in the Congo, up to recently, until January. In fact, the work that I'm doing is still going on there. But all I really did is I connected to the people. In that case, it was the religious leaders from the Catholic Church, because they were in the community, engaged with the community over there. And they reached out to the community, and part of the problem was everyone was saying, hey, they're not listening to us. What do we do? And so instead of saying, we need to tell you something, we said, well, tell us what you want. What help do you need from us? And they told us what help they needed from us. So it came from them. They had to take responsibility. No one can take responsibility for someone else. They have to people have to take responsibility for themselves. So if we ask people what help they need, then, you know, we can help them.
You know, I'd like to ask Dr. McIver, have you had very much experience dealing with the young people that I just mentioned, Winston?
I have, and you know, I think the biggest thing is just trying to get folks just to understand that this affects so much of the body. I mean, you know, and how serious it is. And you know, I'll get texts, I'll get Facebook messages, more so in that mode of communication. but people are asking questions and they are really, really concerned. I still think that there's still a large population, a large number that still has to be touched. And that's why I'm still, agreeing to do these talks and going on social media and things to try to put this information out. Because again, I think people are just saying it won't happen to me. It won't happen to me. It won't happen to me. I mean, it almost kind of reminds me of when I was, in college and working in the CDC. At that time, it was HIV and AIDS. And so a lot of people were still in denial about this happening to them.
Yeah, but I have a question, though, if I can. It's frozen.
Here.
Can you hear me?
Yes, Yaneer. Yes.
Yeah. So when people say it won't happen to me,
then
I think they also probably, many of them also care about their families.
Right. And that's the other thing too, is just letting the young people know, look, you're otherwise healthy. So this may not affect you, but it definitely could affect if you go home and you take it to auntie or uncle or mom or daddy or grandparents. So just trying to hit them in ways that will bring it to home, not just specifically about them, but their immediate family.
Yeah. And the other thing is that, sometimes the people that we see, the ones that are on the street talking to each other, they're not everybody, right? The people that are not there are the ones that you don't see, right? Because there's a technical term for the ones that are obvious are the ones that are doing the things that is wrong, because that's the ones that you see that are outside.
Right.
And there are probably a lot of people that age that are not choosing to participate in those activities.
Right.
And so supporting them, and again, getting them to reach out to their friends,
right,
it is a very powerful way to influence the whole discussion.
Right.
And again, I really think we have to get away from this. It doesn't affect me.
Right.
I mean, this is a community thing. If people die, it's a huge loss for the whole community. You're going to lose families and friends and everyone you care about. And there's way too much focus on, is this going to hurt me or not?
I think the other thing that's definitely a problem, particularly in South Carolina, is that the death rate secondary to COVID has been primarily among elderly people who live in nursing homes.
Right.
And I don't think that, at least in South Carolina, people are under the impression that this is still, people are under the impression that it's an older person's issue. It's not a younger person's issue. Because every time I see information coming from DHAC, and they're just reporting the truth, it's mostly people in nursing homes. In fact, I just read here recently that they're going to have a major effort in testing people who are in nursing homes. That's going to be the first set of people that they're going to test. Yeah. That very well may send the wrong message.
Right. I do think that it's important to test people and to protect nursing homes because they're most vulnerable.
Absolutely.
But the fact that they're most vulnerable has to do with how the disease transmits. Right. If people are together, if any one person gets it, then it's going to go through like wildfire.
Right.
But that doesn't mean that other people are not going to get it and other people are not going to suffer and die. And the threshold, I mean, yes, younger people get it less severe and they're less likely to die from it. But that's a relative thing. And if the disease catches fire, it's going to really affect everybody. And even mild cases, as I said earlier, before you came on, there's a lot more consequences, even to mild cases, that people don't understand yet. And we're learning about them right now.
Well,
And
the other thing too is that unfortunately, it probably was some young employee or some young worker that brought it into the nursing home.
okay,
That's
that's
right.
what I was going to make. You have to ask the question, well, how did these elderly people in the nursing home get it? And they probably got it because a lot of people that work in the nursing home are young people. From what I read an article the other day that said that a lot of people that are employed by the nursing home, that's not their only job. They work other places, so they could get it. You know, sometimes the nursing home is their second job
Right,
or their third job. So
right,
they get it from other places and then they bring it into the nursing home.
Yeah,
right.
So
so
I think that
one of the rules that we should be following is to make sure that everybody that's going into a nursing home is not vulnerable to the disease from other places. And that's hard to do, but that's one of the things that the community should decide to make sure is we're really careful about, because otherwise
So
going to affect the nursing home is again, it's any kind of collective housing. We have to worry a lot about making sure that it's safe. And we have guidelines about how to do that and make sure that people who work in the place are not going to bring it in.
so is this is why testing and contact tracing is important, especially now, because we're talking, what we're hearing is this second wave in the fall, but we're not even done with the first wave.
Yeah, I
We're really
want
not
to
done
say
with the
something
first
about
wave.
second
Yeah,
wave, because this
yeah,
business has
please
become a
do.
mantra, and I know that is people are very confused. This is not a human disease. This is an animal disease. An animal disease means it came into the population and it's explosively growing across people. There is no reason to believe in waves in this disease. Yes, maybe it happens, but only if we don't get rid of it. And if we don't get rid of it, it's going to be a living hell.
Right.
So talk about waves is not really that important. What we really need to do is to work hard to get rid of this disease.
Right.
And so set aside the waves business. Worry about the outbreak. The outbreak now is going to be terrible unless we stop it.
Right.
And here's the word. If your community protects itself from this and you can shield your community, you can be COVID free and forget about other people that have it. You have to figure out how to protect yourself, just like in the nursing home, you have to protect the nursing home. But that's part of having a strategy that the community is going to be responsible for itself. And so the thing about testing is that it helps you know who has it. And if you know who has it, then you can isolate them. And isolating people, you don't want to do them at home because they'll just infect everybody in their home.
Mm-hmm.
So you really want to have the community should set up places. Now, maybe that's in a dormitory, or maybe it's in a hotel, or maybe it's just in a place that you can set up in the community. But the community should be responsible because individuals have a hard time isolating themselves. Now, maybe it's possible to just camp out. I mean, you can camp outside in your yard or someplace, but you don't want to be inside with other people who you might infect. You just don't want to bring them the disease. So the other thing is that if someone has tested positive, everybody in their household should be quarantined, because otherwise they'll infect each other if they caught it. And one of the challenges is that you can transmit it just before you have symptoms. So if you're working in an essential place or you're doing something, you get the disease, you bring it home, you may infect the people at home. You want to make sure that after you're isolated, they don't infect each other. So you want to separate everyone out for 14 days so that they don't infect each other. So again, you want to isolate people who are sick for as long as they're sick and test them until they're not. And everybody else you want to quarantine, which means 14 days without symptom.
Yeah,
Dr. Bell, please speak to this. Go ahead.
No, I was gonna. I have one of my very good friends is in a nursing home. I spoke to him this morning, and I asked him when was the last time he saw his wife. He said he saw his wife for the first time yesterday, but it was only after she quarantined herself for 14 days. All right. If she stayed away from her job and at home for 14 days, and then during that time, after that time, she got tested, and then she could come and see him.
Yeah.
And I said, wow. So to your point, doctor, you're absolutely right about that. Here's the thing though that I'm concerned about, and I know that I haven't said a whole lot about it, but I'm concerned when churches start gathering again.
Oh yeah.
You know that's going to happen around June the 1st.
Right.
I heard today that pastor was saying, we all gonna get together again on June the 1st, and I'm concerned about that. South Carolina is a rural state, and I got a feeling that we are going to find pockets of COVID uh, when we start doing the contact tracing. I saw recently where uh, in certain counties in South Carolina, they are going to be cooperating with the health department, and they are going to start doing contact. Uh, they're going to start doing the testing, and they are also going to start working with the federally funded health centers throughout the state. They're going to use that as a place where people can go get tested. But in places where African Americans gonna start, but they're gonna go to church. You go to church, you're
Well,
gonna go to funerals.
I think the
You go to
thing to
funerals, you're
do.
gonna go to weddings, and I think that all of the social distancing that we've been talking about, just because of our culture, I think all of those things are gonna start coming into play, and I think that we are going to see the quote unquote wave of illness go back up again.
Yeah. So unless there are basically no cases, and so we really have to understand it, unless there are no cases, there can't be gatherings, otherwise there's going to be an explosion. Every time we have groups of people getting together, and it's like a nursing home, right? You have an explosion of cases. And, there have been explosions in churches, meetings that have taken thousands of people, they've infected thousands of people. And you just don't want that to happen. And I think that the answer is, again, you have to talk with the church leaders, right? The make sure that they understand the danger to the people that they care about, right? I mean, they care about their people, and I know that they want to make sure that they are able to interact with the people, because they know that what they're doing for them is also important. And so the question is, how can we let that happen? And Zoom calls only go so far, but they help. But the other thing that you can do is they can meet with people outside, way spread out, and 6 feet is definitely not enough. But if they can meet with people outside in a large area,
Yes.
with everyone wearing masks, and set it up in a special way. I mean, and only if the air is blowing, right, or the wind is blowing, and not if it's just sitting on the ground, because that will be bad. But is setting it up so if the air is flowing, and if they're able to address a lot of people through electronic system or whatever, speakers, it can be made safe. You have to think about what it will take to make it safe, and work with them to make it safe for them to be able to share with the people what they want to share.
Yeah.
In our community, there are two issues that I'm concerned about. And one is these arbitrary dates that the government keeps sending out. June 1st, because, we could go back to church. The virus does not respect dates. The virus
No.
is here. All right. So these arbitrary dates of when we're going to reopening are they're sending a very dangerous message.
Yeah.
And then my other
Zero.
concern,
The number
yeah,
zero is really important. If you have
yeah.
zero cases in the community, then you can start meeting and doing stuff. Zero. You have to get to zero. We have to all understand that until we know and we're sure that we have zero, we cannot take those kinds of risks.
And we don't know because we have not had widespread general testing the way we should have. So we need to assume that we are not at zero. Yeah. Moving forward, right now, people really need to understand that we are not at zero because we have not had enough testing. And then another concern that I have regarding our community is the lack of funding and resources. So we can say we would have the desire of doing certain things, but we have to recognize in doing certain things it's going to take money. And
here's my advice.
There's some issues with that. So yes.
Here's my advice. If you make something dependent on something, then you won't be able to do it because we don't have time. Time is what we don't have. So if you can do it in the community without money, do it in the community without money. If there are members of the community, business people and so on that you can reach out to that can help out on the short term, that's going to be a big deal. The short term matters. So whatever you can do in the short term, but try not to make something depend on something else. Try to figure out a way to do it without waiting for money, without waiting for the government, without waiting for, whoever it is. If you take responsibility for yourself and if you work together with other people, you can do a lot that you would think is not possible. And that's a really strong advice because again, you want to save your lives, you want to save your health, you want to do the right thing. If you wait for something else to happen, you'll stop yourself. So do as much as you can yourself. And if there are things you can't do, well, try to figure out a way around it.
Dr. McIver, I know I'm going to ask you this question because I know you keep up with this kind of stuff. The last time you checked, what was the percentage of South Carolinians that have been tested thus far?
Right now, it's a little over 1%. About 10 days ago, we hit, about 8 to 9 days ago, we hit over 1%. So I probably would say it's about 1.2%, 1.1%. I mean, for the longest, it was just horrible. And that's the reason why we got the F on social distancing and we got F on testing because we were just so far behind. And, I think, my take on this is I try to make things as much to a math equation as I can. So the way I see it is education equals knowledge and knowledge equals power. So I think the way that this is going to be effectively reduced is by continuing to educate and continue to educate the folks who have the ear of folks. So talking to the preachers, talking to the business owners, because these businesses are opening up. So what I said to a number of business owners, and I posted this on Facebook, was that these licensure boards that are allowing these businesses to open up, they're giving minimums, they're giving recommendations on what to do. Those recommendations are just minimums. They're bare minimums. So these businesses, if they're going to open up, they've got to think outside of the box on how to help protect their businesses, their clients families, the business workers and owners' families. When you start looking at that approach, I think that will help with the education equals knowledge equals power. These businesses are going to open up because these politicians feel pressed to do so. And I get it. People have to work. People have to make a living. I get it. So I think the best that we could probably do is educate these folks on what can happen. I mean, I'm reading all the time about these, barbers who are cutting hair when they wasn't supposed to be cutting hair and ended up getting COVID and some of them dying. I mean, I get it. You're working and you want to support your family and support yourself, but you're not going to be much help if you're 6 feet under. And so I'm just example. I use it as an example. But I think the biggest thing is just education. Education on what can happen if you don't do these things.
That's right.
Politicians are going to open up these businesses. I mean, they're going to open up. You know, it's an election year, an election time. People don't want to see the unemployment numbers, you know, go, you know, like they're going, for fear that they may not get reelected. Because one of the big things that we haven't really been talking about as much in the media and as much is that when these people lose their jobs, they're losing their insurance as well. Mm-hmm. So when you got millions and millions of people that are unemployed, that are not working, their insurance likely is gone as well.
So they're going to develop high blood pressure and diabetes.
They're not going to be able to afford the blood pressure medicine, not going to be able to afford the diabetes medicine. They're not going to be able to afford the asthma pumps that they need to be taken, and hence the cycle. So that's the importance of this education, as Yaneer said, to stop the progression, stop this spread, because it will continue to do more damage. And I just don't like the fact that politicians just seem resigned to saying, okay, well, 120,000 people are going to die, as if that's just okay. That's a city.
And it's not okay. And I'm going to take this one more step, Dr. McIver. It's not only important that we educate, we are going to have to supply masks. As Yaneer said, there are a lot of people, if you lose your job, you can't go out and buy the mask, or the supply is so low. We're competing with each other to get the supply of the mask. We're going to have to figure out a way, how do we get masks to people who cannot get them? And the young people that Dr. Bell mentioned, how many of them even have access to the mask? How many can afford to get them? Is anybody at home sewing masks? I doubt that. We have to be innovative and think out of the box, and they say not only educate about the virus, but we have to supply people, because the government is not doing it. We have to give them gloves and masks, the tools to save themselves. And that's a real thing. And it goes back to the churches. The church is the institution in our community that is organized, that could probably pick that up and run with it. And we're going to have to do that to save ourselves as a community. And that, I agree with Yaneer on that. The government historically has let us down in so many ways, and right now it's letting us down. We can no longer afford to wait for them to do the right thing. We have to save ourselves. And it's not just about the education, it's about actually going to people and say, here's a mask, you got to wear it, and this is why.
Yeah, and I'm not saying that you shouldn't go to everybody with institutions, for all kinds of organization, to make sure the hospitals are doing the right thing and so on. But you start with your own responsibility. You do as much as you can, and then you go out and you see what else you need.
Yeah, I was talking to one of my I was talking to my barber this morning. I'm like Winston. But anyway, I do go get my mustache.
We are making up for that here. Yeah.
So anyway, he was telling me that he's going back in the morning, and that they're going to have to put some new things in place. You're going to have to go by appointment. They can only have so many people in the barber shop.
Yeah, you do it outside. You really got to understand. Fresh air is so important, and barbers and anybody who's near someone is going to be totally at risk. Barbers should be the last thing that opens before big meetings,
right?
And it's really not a good thing to be anywhere near. I mean, look, when you have a doctor in a hospital or a nurse in a hospital, they need to wear full protection equipment, masks, hood, some kind of a shield. They need to wear gowns, and they need to change them all the time in order to be safe. And they're still not safe. I don't understand how you can have barbers or someone who'd be safe. It's just not a safe thing to do.
Well, to Winston's point, he's right. I asked him, I said, well, where are you all getting the guidelines so that these barbershops can be safe. He said to me, the guidelines are minimal. We've had to go online and kind of figure it out for ourselves.
Right.
And I said, oh my God.
Right. Yeah. That's the concern. And there was something that was just put out earlier in the week talking about human speech generates droplets that can linger in the air anywhere between 8 to 14 minutes.
Actually,
or longer.
More. It's longer. It's several hours in terms of what happens.
At a minimum 8 minutes. So that could explain, about the clusters being seen in nursing homes, conferences, funerals, churches, cruise ships, and those kind of things because of the decreased circulation in a lot of these smaller rooms.
Yeah. So if you walk into a room where someone was there within the last few hours,
it can still be there.
It's still there.
Right. Right.
Yeah.
And you're breathing it in.
Right. And that's
breathing it in. Yeah.
And that's a concern. So again, that's why looking at these guidelines that these restaurants and barbers and beauticians have, it is just a minimum. They have to think outside of the box for ways that they can make their establishments even safer.
Here's a good one. In New York, they're starting to open up only in areas that have very, very few cases.
Right.
Guess what they opened up? Drive-in theaters.
Right. Right. Exactly.
That's kind of smart.
Exactly.
Right. Everybody's in their own car.
Right.
So that's kind of the way to think about it. You don't want to be near anybody.
They talked about that around here in this area about a number of drive-in theaters being reopened.
But walking into a theater and being in the same room with someone, that's just nuts.
Right.
It's not going to work. So I have a couple of suggestions and questions from our audience. One great suggestion to hopefully get the message out: videos and messages from student council members and class officers would be good. And Dr. Bell, that was in response to when you were speaking earlier about Generation Z, our younger folks. Maybe that's a good way to get the message out. And the question is, when will the issue be addressed that exercise and nutrition needs to be a vital role in healthcare, so we have less people with disease and risk factors that are targets for many viruses? Dr. Bell, you could probably speak to that, as you've been working on that for many years, addressing health disparities.
Well, yes, and thank you very much for the question. I've been a little disappointed. However, I understand the urgency to discuss what we have been discussing with reference to social distancing, wearing the mask, and etc. But there's a part of this that we totally have not been discussing, and that is looking at the risk factors that are very, very high in African Americans and the underserved in the first place, and looking at high blood pressure and explaining to people why you have to take your blood pressure medicines every day. Just doing the basic stuff, just to make sure that they understand that, first of all, that's a major risk factor. And secondly, if you take your medications every day and keep your blood pressure under control, it will decrease your risk for having a bad outcome. And the same goes for diabetes and asthma and obesity and some of these other issues that African Americans have. And the person who asked the question, they're absolutely right. We know full well that, exercise does so many things. I like to say exercise is medicine, but one of the things that's very relevant to what we're talking about today, and that is it definitely improves your immune system.
Yeah.
Because you need everything that you possibly can to fight off this COVID. Right. And if you can improve your immune system by staying in good physical shape and by paying attention to your medical issues, that's very, very important. And I just don't think that the news media and even the doctors who come on talking about this on radio and television, at least when they're talking to our community, they are not emphasizing that enough. That has been my impression.
Yeah.
And the other thing too is that particularly in a state like South Carolina, there's 46 states, 46 counties in South Carolina, 10 of them don't have hospitals. So in those areas that don't have hospitals, the access to health care is limited. Some of these people are having to drive 30, 40 miles to get adequate health care. So that's a major issue. But one other thing I want to mention too, and I'm seeing this more and more, and it's this situation with gloves. Okay, seeing people wearing gloves. Okay, take these gloves off. Don't wear the same pair of gloves every day. So I'm seeing people get out of their car with gloves on, walk into the store and touching things in the store with gloves on, and walking out with the same pair of gloves on. So if you're going to wear gloves, if you go from your car, as soon as you get into the grocery store, put another pair of gloves on. Because if you go in and you're touching things with these gloves that you've been wearing all day, you're putting stuff on these objects that other people are touching all day. I went in to buy some meat from the grocery store yesterday, and I was almost afraid to touch the steaks because I didn't know how many other people had already touched it. So the thing about these gloves is that, you know, people are wearing these gloves they're pumping gas with the same pair of gloves. They're going to grocery stores with the same pair of gloves. They're wearing these same pair of gloves every day. So please be a good steward. If you're going to wear these gloves, take them off before you go into the grocery store, put a new pair on, and then go and do what you got to do. Then take them off when you leave the grocery store, because then you're taking what you got from the grocery store back home with the same pair of gloves on. Yeah. So the thought about that has to kind of change. And again, it gets back to education about things. Okay. And it's not that we're knocking folks. It's education, and people need to understand that.
There's another thing. If you're dealing in, the best thing is not to have to walk into the grocery store. It would be really good if they can set up delivery, if they can set up drive-by pickup, right, and have, you know, one of the ways to make it easy for the store owner is to have standard packages, you know, with the standard things that people buy in the grocery stores, so that you just drive by, either they or you pick it up at the curb and stick it into your trunk and drive away with it. It's really so much better not to go inside. Right. The risks go way up when you're in a closed space instead of being outside. And yeah, that's a much better way to do it. And again, this is the kind of thing that the community can also help with. You know, talk to the grocer, talk to the manager or the owner and say, you know, we really want to be safe. It's going to be much safer if we set up. What do we have to do to help to set it up so that we can do drive-by? And maybe the community says, okay, you know, we'll take orders from people and we'll have, you know, we'll set it up so that one person can bring it to a part of a neighborhood or something like that. So you only have to go shopping also once a week or once every couple of weeks. The best thing is to shop very infrequently and not to have to go into the store. It really matters. And it protects the people who are going in. It protects the workers in the store. And so you just, it's much better for everybody.
I think,
Yaneer, go ahead, Dr. Bell.
I think one of the things that I think, you know, as I sit down and I reflect on this a lot, this virus has caused us to go against every natural thing that we would ordinarily do. Every natural thing, everything that comes natural to us up until this time, we are now going to have to go against that. And I think that that's hard for people to understand. Yeah. I also think, and I think this conversation with these doctors has been a good one, because it has taught, I think there's one thing that people should know. They should have gotten from this conference today so much more information that they probably have never heard through the regular media or other doctors talking about. The thing that Dr. McIver mentioned, about the gloves. the thing that Dr. Yam has mentioned about, being in close spaces with other people. I just don't think that, particularly the African American community, has heard that kind of information before. And so I hope that they will start asking those kind of questions, not only to their healthcare provider and to other people who they trust to get information from, because it's a lot of terrible information on Facebook right now.
Yeah, very confusing. It's very confusing.
Yeah.
And again, I think the most important thing to understand is that this is not normal. And you said that people have a hard time with it. And in January, I put out a piece, an article, all on the internet, and it was really widely distributed, where we said, this is really dangerous. We got to stop it from coming here. And a lot of people said, no, it'll cost so much money to shut down flights. But if we'd taken the action to stop the flights then, we would have saved ourselves all of this. And every time that people are thinking about what we need to do, it seems like a lot. And why don't people do it? And the answer is because everyone thinks that the normal that we have is always going to be normal.
Right.
But there's something weird about it, because now a lot of people think that what's going on now is going to be normal. And that's just not true. It doesn't have to be normal. We can go back to the other normal if we take responsibility and get rid of the virus. But we have to understand what it'll take. It'll take a lot of work, but it doesn't have to take a lot of time.
Right.
It only has to be a few weeks. This is what I've been trying to tell people. It takes about 5 weeks. Because of the incubation period being a couple of weeks, you have to figure out who's sick, and then you have to make sure that the people that they infected, you still get, make sure that they're isolated and quarantined and so on. But roughly speaking, 5 weeks, and we could get back to the real normal, the other normal that we had before.
Yeah.
And so there's this mental block that people have, that we say, what's happening now, that's what's going to be forever. And it's not. It doesn't have to be. It's our choice. That's what Winston said. He says, the disease does exactly what it's doing all the time. It's not changing what it's doing. But we have the ability to change what we're doing. And so it's our choice what happens. And that's why it's so important that we work together in the community and figure out how we're going to deal with this. And we have to use every resource that we have, because it's a really hard thing to do, but it's so worthwhile. It's so worthwhile. And that's the most important message. And there are some specifics that I would like to explain. I don't know how much time we have.
No, go ahead, explain it. Go ahead.
How much time do we have?
When I decide to end the show.
Okay.
Marilyn, I'm going to have to leave because I'm going to have to go.
I know.
By the way, Dr. McIver, today is my birthday.
And happy birthday, and Yaneer and audience that are listening to us. I have to always give this man credit. He is one of my mentors. So I have to say that, and it's an honor to be here on with him. I picked his brain when I was in college. And right before medical school, he gave me a very nice medical dictionary. And I was thankful for that. And I want to give him a lot of credit, because he really answered a lot of questions for me. And I do thank the world of him. And he is one of my mentors. So I do want to
much.
Thank you, Dr. Bell.
If I can say, before you go, I really, really appreciate your emphasizing the issue of health. It's something that I haven't heard anybody else talk about, except that I've also been trying to give that message. So we really share it. And it's just so important, because if someone gets sick, it could be the difference between them walking away and getting very severely sick and being in a hospital and even dying, right? So that taking care of your health is super important. And I don't know if you can move it because I didn't find how to put the live comments, but I put in a link to a piece which says exactly the same thing you do. So we really are on the same wavelength, and I so much appreciate it because I've talked with many healthy people, including in the government agencies, and I haven't heard anybody talking about health. I don't understand it.
Yeah. Well, listen, Marilyn, great job. Thank you very much.
Thank you.
Winston, I'll be in touch.
Oh, we will.
Please, before you go, Dr. Bell, I want to wish you happy birthday. I knew about it. So happy birthday.
Happy birthday.
And this goes to this project you and I have been talking about.
Yes. Yes.
So we need to get together, and hopefully Dr. Yaneer will come in with us and help us with that too. But we need to talk about that.
Absolutely. All right. Y'all have a good one.
All right. Thank you.
Care.
Okay.
So Yaneer, as you were going to tell us, I know you do have a website that I've been sharing at the bottom of the screen most of the show, and I do encourage folks to go to this website and get more information. And Dr. Yaneer, please, I say Dr. Yaneer, that's Yaneer. Please share with us some details. I think we'll go another 15 minutes.
Okay. One of the problems that we all face in dealing with this is uncertainty, what we know and what we don't know. And there are some things that we should realize. It's hard, but I think everyone can realize, there are things that you know and things you don't know, and you have to be careful also of things that you don't know. And the standard tests that are being done, they're really super important, but they're not perfect. So if you have symptoms and you get tested and it tells you you don't have it, don't be entirely convinced by the test. So it's better to be, this is one of those, it's better be safe than sorry. You still want to be protective. If you have really clear COVID symptoms, if you have, difficulty breathing, and, coughing and stuff like that, and the test comes back negative, go for another test. Because the test is about 1/3 of the time it's actually not right. And you don't want to go back and infect your friends and family, or go back to work and infect other people or whatever, just because the test told you, hey, you're okay. You say, hey, we're done and I'm fine. It's not always true. Now we're trying to fix that, and I hope maybe Winston and other doctors down there will help us with this. We're trying to get them to use a better test, which is CT scans, CAT scans, because CAT scans are much, much more reliable in telling us if we don't have the disease. That's what we want to know, because if we don't have the disease, then we can go back to normal. So that's one thing that I just wanted to caution you about. There are other things, and Marilyn has told you about our website, and we have a whole bunch of guidelines there, but the main thing is, think about the community and what the community needs to do in order to protect itself. And that really means, being careful about social distancing, wearing masks, wearing gloves. And, if you're in a shared space, as we said, be aware that someone walking through there a few hours ago may have left you something that you don't want in the air or on the surfaces, because the stuff that they breathe out drops onto the floor and onto the stuff in the shared spaces. So you don't want to, you want to be really careful. And if you're really careful, and it's like getting a little bit paranoid. It's just the way it is. You can protect yourself, you can protect your family, you can protect your friends, and you just want to make sure and do that. And then about the testing, as soon as you have symptoms, hopefully they'll set up the testing so that you can get there easily and it's convenient and all that stuff. And that's super important. And make sure that you do the tests, find out what's going on, and to the best of our knowledge, right? Again, it's not always 100%. It's not 100%. And then you have to be careful about isolating. And anybody that tells you isolating at home is okay, they're full of it. You got to isolate away from home so you don't infect your family or your roommates. and make sure that people who are exposed, right? If you're sick and you were near someone in the last few days, make sure that they quarantine for 14 days. We got to stop it. The basic idea is that if you think about it, every time someone is near someone else, if they transmit, the disease kind of transmits and transmits and transmits. So what you want to do is you want to make sure that you cut all of those links. And if you cut those links, the disease dies. It can't live if it doesn't transfer from person to person. So you want to cut all of those ways that it can transmit. Right. And if you think about it that way, you'll realize that we can stop it. We just have to change how we behave. Just is not an easy thing, but we have to do it ourselves. We have to make sure of it ourselves, and make sure you don't believe. There's a whole bunch of people out there that want to convince you that it's okay to go back to normal. And bottom line, it may be okay for them if you go back to normal, but believe me, they're not going back to normal. And if they claim they are, it's bogus. Everybody should be protecting themselves, because unfortunately there are a lot of people out there that just don't care. Right. And that's hard for me, because I don't understand when people don't care about other people. I've never understood it. And I don't think that anybody should accept that we don't care about each other. Right. So take care, really. Take care of your health. Take care of the health of others around you, and remember that it's not a single person's decision. It's everyone's decision together to get rid of this. So work together with other people, and talk to them about it, and make sure that everyone is working on this so that we get rid of it.
Right. One thing I'd like to say too with the testing is when people go and get tests done, that they understand exactly what kind of test they're getting done and what it actually means. Yeah. Right now, there are 3 different types of tests that are out on the market. There's the viral test that picks up protein particles to tell you if you have COVID-19 at the present time. There's the antibody test that tells you whether you have IgM or IgG, which are these immunoglobulins that go up in some response time to being exposed to the virus. That tells you if you have previous exposure. And then just this past week, there was an FDA approval for an antigen test, which I'm excited about, although it may not necessarily give the highest degree of certainty. It's better than what we have had, and it can give us a lot of tests that can be done at one time. The antigen test will be just like if you go into a physician's office and you get a strep test, a flu test, it can tell you real time. Again, all these tests are going to get better. All these tests have to get better. All these tests are not 100%. But again, as they're going in that direction, as the FDA has told these 200 different commercial manufacturers who put tests out, you've got to show that your tests are valid and reliable. It is getting closer to what we'll need to help identify. Again, they're not perfect tests, but again, it's at least some movement in the right direction for the FDA to admit that some of these tests are flawed. The one that Trump was touting, the Abbott test, was shown to be 50% inaccurate. So some of these tests are not measured.
That's like tossing a coin. It's really not.
Exactly. So just make sure when you get these tests done that you understand what these tests are testing for and what it will tell you.
Very good point, Dr. McIver. I also want to point out to folks, and I'm glad Yaneer brought this up regarding the cost of things. This show that we've been putting on, and I think this is like number 10 or 11 now, comes at no cost, because we decided to just do this show get information out and invite people in. And I mentioned very briefly that Dr. Bell and I are working on a project, and we're taking it to the next level because we realized that we had to address this coronavirus in the community and really drill down and get to, as he mentioned, I think Generation Z, and really drill down to get to them. And we're trying to figure out how to do that now But we are working on a project that we hope people will step up and volunteer and help make it happen, addressing the coronavirus, but also addressing underlying health disparities that's making it so deadly for our community. So I want folks to stay in tune with that. But to take what Yaneer said even a little bit further, this testing, for example, Dr. Mack, what you just said, if you go to a community health center, many of these community health centers are providing testing at no cost. These federally qualified health centers have to, if you can afford primary care, if you can afford these testings, they're supposed to provide those testings. The key is getting the message out that the testing is available, and that's starting to happen more and more, but we're going to be part of that solution also. And with the glove situation and a mask, our community institutions such as the churches, fraternities, sororities, we're going to have to step up. The Masons, all those Masonic lodges are going to have to step up, and we're going to have to figure out a way how we're going to get people with the mask. I think a lot of people are not wearing masks, in particular young folks, because of lack of access. And so that's a problem that can be solved. It can be solved. There are people out here who are sewing, making very good homemade masks that are doing the job, and we can do it. I had a friend drop a couple off to me. I had a cousin mail me some stuff. You know, but the resources are out there, but we do have to come together, as Yaneer said, as a community, and save ourselves. Yaneer, I have been showing your website most of this hour, and is there anything else that we need to know? Specifically, you gave us some very good information and resources. Anything else we need to know today that you can think of?
I really appreciate the opportunity to participate in the effort. And basically, the other thing is that I'm happy to help. Let me know in what ways you would like me to help. I can't do things for you, but I can help in many ways. Just reach out to me. Let me know in what ways I can be of help.
Oh, we certainly will. Believe me, we will. We will, because there's a lot. I do have a question. Maybe you and Dr. Mack can answer this. The 68-page CDC plan that was given to this White House, is there any way that we can get a hold of that plan, or is that something that we can't get to?
Now I don't know what the current status. I haven't looked. I know that there's been talk about it. I don't remember where it is now. I don't remember. I'll have to look it up.
Okay.
Yeah.
Okay.
I think that. Let me not answer because I don't know. Yeah.
Okay. All right, that's fine. Well, what I'm going to say is, because we can't maybe get that 68-page CDC report, that this is why we have resources such as Yaneer, and we'll go to your website and look at what you have on your website as a resource.
Part of
go ahead and talk to Matt.
Have you been on their website? Because part of those guidelines are broken down individually on their website.
Yeah.
On the CDC website.
Right. So it's on their website broken down. The issue is that it's two ways to look at it. It's one's as individuals that we can look at and things that we can do. But the other thing, there was recommendations on what the government should be doing.
And this is part of the problem, that there's so much there. I have to agree that there's a lot of stuff that individuals can't do, but then if the community gets together, it can do some of those things.
Right.
Then, we have to figure out how to, still press the government to do other things, whether it's a local government or the state government or whatever. But we can't depend on them. That's the problem.
Right. And part of the issue too was that two of the biggest things that was supposedly a determinant for reopening was 14 consecutive days of reduction in deaths and cases, as well as having robust testing being done in individual communities, none of which have happened.
Right.
So again, those they're parts of it that is on the CDC website, and the things that you can implement in your own areas. And part of it is what we're doing now, talking about it. I know you and Dr. Bell have been doing a lot. I've been, privileged to come on. April Gardner and myself have been doing a lot up on our end, a little bit further up the coast. So I think a concerted effort by people who understand what's going on as much as can be understood, and understand that the only constant is change in this situation.
Right.
That we keep pushing this information, keep having platforms such as the Gathering Place, such as what April and I are doing on Fridays, that just put information out and keep trying to share it with as many people as we can in this free mode of providing information. So I think great. I think continuing to do this is great. I think this is what's going to help out. It helps churches out. It helps organizations out. And so that way they understand what's going on. I've had a number of preachers call me, text me, inbox me on Facebook, asking me questions or asking my opinion on certain things. And a lot of it is because of information they heard on these various platforms. So
I realized there was one more thing that I had thought to mention, which is we touched a little bit on businesses and how businesses can change their practices. And the main thing is that it's very hard. You can set up guidelines, and we have guidelines on our website for businesses, but each business is different. In the local conditions are different. So if you understand the principles, you can build a plan.
Right.
And what you need to do is to create a real plan that includes how distance and how caution and how masks and so on are going to protect people, but also you can think again out of the box. Can you do things outside? Can you do some of the things remote? Can you set it up so that you don't have to do everything in the same way as you were doing before, in such a way that you can protect people? And if you come up and also about the safety of the people that work for you, right? So where are they staying? Are they staying at home with family, like with a nursing home? By the way, one of the things that is happening all over the country is that medical professionals don't go home to their families. They go to hotels in order to protect their families. And that may be covered by the hospital, or it may be covered by the government, or something, some help in between them. The point is that you really want to think through what are the ways that we're transmitting the disease and to stop it as much as possible. Healthcare workers do not want to infect their families. And obviously, people who work in a nursing home, they want to be super careful not to bring it either to their families or from their families into the nursing homes.
Very true. And I want to encourage people that reach out to your elected officials, because we can still do advocacy. It's very correct to say we need to make individual changes, but one of those things is we need to advocate for the community, because there are still things that the government can do and should do, but if they don't hear from us, they're not going to do it. They're going to listen to the people who are really talking to them in their ear. And as a community, we need to start getting on the phone or email folks, and a lot of us are at home, and we can do this. Email and call your elected officials and push them to do what they need to do for the communities. But as individuals, we need to do what we need to do. And Julius Jones made some good suggestions. Change our behavior. It does not take the entire household to go to the grocery store. Designate the grocery store shopper. We have got to take control of this, folks, because as Yaneer said, we've got to get to zero. And we know we're not at zero because the testing has not been done the way it should have been done. So we've got to take control of this and just make some individual changes and still advocate for our community with our elected officials. So this has been a great show. It's been very informative. Yes, thank you, Yaneer, for coming on. I really appreciate that. A little bit longer than usual, but I think it was definitely worth it, the information. Dr. Mack, anything you want to wrap up with, and then Yaneer can also wrap up.
Well, just continue to be vigilant about protecting yourself, protecting your family, protecting your community. There's nothing wrong with wearing a mask. It's not a sign of weakness. It's not a sign of fear. It's a healthy respect that should be taking place. There's, almost 100,000 families in the United States that have had to bury loved ones as a result of COVID-19. And again, if we don't do anything, if we don't do more about this, there will be more deaths. there will be, unfortunately, more deaths. So just protect yourself, protect your family, protect your communities. And it was good to meet you, Yaneer. And Marilyn, again, thank you for asking me to be a part of this platform.
Thank
Thank
you,
you.
Marilyn.
Thank you.
Thank you,
Thank you,
Winston. You
Yaneer.
said it perfect. I don't
Yeah.
have
Thank
anything
you.
more. Take
Okay.
Yeah,
care.
we will. Yaneer, we're gonna be in touch. Believe me.
Good.
We're
I'm
gonna be
looking
in
forward
touch.
to it.
Thank you, Dr. Mack. It's been good as usual. And I want to thank everyone for joining us today for a gathering place. Please go out and be safe. Practice social distancing. Wear your mask. And if you have, wear your gloves. Wash your hands. Do everything you can to protect yourself, protect your family, and protect your community. You'll be hearing more from us as we move forward with this. Everyone, please have a wonderful day and good night.
Take care.